your decision tree are not every step will you use. Okay? So that's, when you use your decision tree, you kind of have to get it to where it works, that you figured out how to use it to make it right for you. Okay? You make it work for you. You have to take ownership of the decision tree. Now, when you have, I will always ask you, is this a priority question or is this an evaluation question? And then if it's a priority question, the last statement in your question will have words like but most, first, immediate, even the word priority. What priority action will you take as the nurse? That's a priority question. Now, all the others then are evaluation questions. Who do you see first? I know that word first is there, but that's not like what are you going to do first? That first is a priority. This first is you're going to look at a group of people and which person are you going to go to first. So you're not going to really use your decision tree when you do the who do you see first type of question. You're going to use, and if you have it on your posters, the who do you see first rules. And there's a poster, and I can show it to you. Let me show it to you real quick. Sure. Here we go.
There's Winston.
Oh, did you see my baby? Hang on, let me show you. That's my baby Winston. He's gone. He was 12 years old when he died. And I still have him up here. I can't change that picture. I have Layla though now. Layla's a little what is she?
King Charles.
King Charles, thank you. She's a doll baby too. But I'll tell you all about that sometime. Okay, so let me see, where did I put these posters? I think I know. Alrighty. So your posters will look, if you have them, something like this. And if you don't, let me know because I can get these to you. Give them to Miss White. Okay, there's your decision tree. Here is your who do you see first. This is what you're going to use when you have who do you see first type questions. You want the most unexpected patient, whatever's going on with him, versus expected. You want the most acute versus chronic problem. You want the most unstable versus stable problem. You want an actual problem, not a potential, when you're trying to decide who to go to first. You want the one who's the most unsafe versus safe. And you can bring in your ABCs if it helps you decide who is the most acute. Who's having trouble breathing? If somebody's having trouble breathing, that makes them way up to the top. Okay? So on your poster, you can write somewhere in pen, bring in the ABCs to help you decide. Okay, that right here is what you call who do you see first poster. That's what you use instead of the decision tree. So you have test-taking strategies, and this is a strategy. Another one, you want to know your common traps. Like, don't ever ask why. That's confrontational to a patient. So if you see any why answer choices, you can get rid of them. Don't ever leave a patient alone. Okay? Don't ever try to persuade a patient. Oh, now listen, my aunt had this surgery and she did really good. You need to do it. No, that won't be an answer choice. Don't ever say, don't worry. That is not therapeutic. So you can get rid of that answer choice. Be careful not to pass the buck. Don't give up what's something that you can do first as a nurse before you go call the doctor. Is there something in those answer choices that you can do that goes with the topic before you go get the RN or before you call the doctor? Because if there is something you can do, that's what you're going to do first. That will be your answer choice. So if you can sit them up in bed and make sure their clothing isn't restricting, then go call the doctor or have someone go call the doctor. That's what that means. You don't pass the buck when there's something you can do as the nurse. And don't put your answers, don't pick answer choices that you're having the family do things. Every once in a while, yes, if that's the only answer choice, you will bring in the family. But be careful, because there's times when you should be doing it, not the family. So that's passing the buck. The one other big thing is don't read into questions. That's really hard. If you start saying, yeah, but what if? Yeah, but what if they, what if this, what if that? You are reading into it. You want to stop doing that. And be careful about do nothing answer choices. If it says something like, wait until tomorrow and then call the doctor, that might not be the answer. That's kind of a do nothing. Or if you say, the answer choice, tell the patient to call the doctor in 3 days. Again, that might be a do nothing. So be careful with those. And then here's your therapeutic tips. So you want to respond to the patient's feelings. You always want to provide information. You always want to focus on the patient. And sometimes silence is a good thing. And use your presence. You being there is a good thing. Not therapeutic is, again, don't ask why. A lot of times you will not ask yes or no questions. You will ask open-ended questions to get them talking. The only time you will ask yes or no questions is if they are going to harm themselves. Have you been thinking about harming yourself? Yes. Then that's appropriate. Or answer choice, if they are going to harm someone else. Do you have thoughts of harming your neighbor? I sure do. Okay. That's your answer choice. Okay. So yes and no is okay.
A little much too information.
Yeah, exactly. Yes or no is okay if it's about harming yourself or someone else. Otherwise, you don't want to use yes or no questions because you want to use more open-ended. Remember, don't focus on the nurse. You know, like, well, I've had so many patients that I've taken care of with that problem, and that's focusing. That answer choice is focusing on the nurse. I don't care about the answer choices where the nurse says something about her. You focus on the patient. Be careful about exploring. We don't want many psychologists. We want you to stay within your scope. Yes, you want open-ended questions, but be careful about saying, let's explore the reasons you feel this way. That's out of your scope. That's too much. And again, don't say, don't worry. All right, another biggie that I didn't get into last time that I want to tell you this time before we start practicing a little bit is delegation. You need to know about delegation. And there's an easy way to remember this if you remember almost one thing. And I say almost because nothing's that perfect. But if you remember that the RN, and this is NCLEX, this is not real world, and remember, real world and NCLEX are two different things, okay? And there's reasons for that, and maybe I'll go into that another time. But for right now, just know that real world isn't always going to guide you to the right answer. You want to follow NCLEX rules. Now, with delegation, if you remember that the RN is the only one that can assess, that can teach, and can use nursing judgment. Now, the LPN can gather data, but she doesn't assess. If she's hooking a syringe onto a catheter and pulling back to see if it irrigates, that's assessing. That's not gathering data. I know there's a fine line. So if you are assessing, you're doing something to make a decision. An RN is the only one that can do that. But you as an LPN can gather all kinds of data and give it to the RN and let her make the decision, and then you will go carry it out. Because you are allowed to implement. Yes, you can do sterile technique. Yes, you do wounds, dressings. Yes, you do suctioning, trach care. Yes, you start IVs, hang IV bags. No, you never push a medication, IV. Yes, you can not irrigate. Yes, you can flush your IVs. Yes, you can flush central catheter lines. Yes, you can flush PICC lines. But no, you can't push Lasix. No, you cannot push an antihypertensive medication. No, you cannot push a pain medicine. No, no, no. But you can hang a piggyback, and you can hang a big bag of solution, and you can change tubing, and you can change the IV dressing, and you can DC the IV, and you can restart an IV, but that's after the nurse, RN, tells you, yes, you're right, it is infiltrated. Yes, you can DC it. Yes, you can restart the IV. The RN makes the decision. She makes the nursing judgment. You gather the data and give it to her. Does everybody understand that?
Yes.
Okay,
Yes,
good.
ma'am.
I hope that has helped you in kind of
Ms.
understanding
McBride.
that.
Ms. McBride,
Yeah.
can LPNs DC PICC lines?
No.
Okay, thank you. That was
No,
just for
they cannot.
clarification.
Yeah, thank you. No, they can't DC PICC lines. Only an RN or a PICC line nurse. Yeah. Very good. And they cannot DC catheters. They can't take a subclavian out or a jugular. No. But you can DC a peripheral IV line. Does that make sense to everybody?
Thank you.
Okay, now, so that's the big thing that you want to remember with delegation. If you can remember what the RN is the one that does, everything else kind of falls into place. But you also kind of want to keep in your mind that as the LPN, you are really only allowed to be assigned to stable patients with expected outcomes. You are not able to be assigned to a new patient or a new admission. You can't really have a discharge because there's a lot of teaching, and only the RN can do that. You can't have somebody coming back from surgery or coming from the ER into your unit because that's like a new admission. If they come back from surgery, again, that's like a new admission, starting over again with new orders after surgery. Only the RN. An LPN cannot take care of somebody who's like getting interferon and who's very sick. There's too many assessments going on. The RN has to take care of that. Unstable patient. But other than that, the LPN can take and be assigned to a stable patient with expected outcomes. Now, the UAP, unlicensed assistive personnel, if you guys don't mind, can I just call them an aide? Because I can never remember UAP. So you'll hear me say aide or tech. Now, the aide can be assigned to patients and can do standard unchanging procedures to stable patients. So, ready to put your hats on and your shoes and sit down. Don't let the wind of what I'm going to say blow you away. So, guess what? An aide can give a tube feed. Yes, they can. If the patient has a history of SAH, subarachnoid hemorrhage, and is in a vegetative state, and gets tube feeds 3 times a day, guess who can give it? Yes, the aide can. The tech can give the tube feed. The patient had a history of SAH. Doesn't mean it just happened. So they're stable. They've been in that state maybe for 20 years. Okay, and they're in a long-term care facility. Now, who checks for the position of the tube feed? You guys, who would check for positioning of the tube feed?
Would it be
Yeah, why is the RN?
because the LPN, well, we can't do anything with the chest tubes other than monitor for like signs and symptoms afterward.
Right, you
Or
can't
during, whatever.
basically, just to keep it simple, but instead of going into all that, it's that one word, assess. An LPN cannot assess whether the tube is in the right spot, period. Only the RN can. So the RN has to say, yes, the tube is in the right spot. That's already been done. And then the aide can take over and do the tube feed. Does everybody understand that? A standard, unchanging procedure.
Hey, Miss McBride, they can check placement of NG tubes though, right?
In real world, we sure do.
That's what I thought, because that's how it's taught in our books.
Yeah, absolutely, we do, and we also have to learn how to do it. But on the NCLEX test, it won't be an LPN. They just keep it because Tennessee is not the only state that takes it, and
because there's many questions on that, and it does let the LPNs do it on the PN NCLEX.
Oh, you mean as far as practice questions?
Yeah, and because for NCLEX, it said they can do it.
And it might be able, depending on what the question is saying. And yes, that very well. I guess I would have to see the question, but and it might. But according to what this has, and it's always been, unless they've changed that part, which I haven't heard, is that that's still part of assessing, and only the RN can. Now, you won't get, as an LPN, when you're taking your test, you're not going to get anything pretty much like that. They're not going to confuse you like that. It'll be pretty obvious, a question like that. An LPN won't even be involved. It'll be the RN and the aide in the question. Okay? So, or it'll be the LPN and the aide, and it won't be about the tube feed. Because I honestly, I've not run into that question yet at all. So, and Sherry, if you do, let me know, because I kind of want to see what it's saying. And then I might
because I test on that, and I asked them what they would do before they administer a tube feeding and what they should be doing before they administer a medication.
They need to know that. Absolutely.
Okay.
Don't stop that. No, don't stop that, because I do too.
Okay.
I'm just saying on this is just kind of a way of thinking on the NCLEX. But no, you know very well, long-term care facilities, or really anywhere you work, we as LPNs, we are given tube feeds all the time. And we have to check placement. Absolutely. Yeah, in the real world. Yep, absolutely. Okay. Does everybody understand the delegation? Okay, so I did want to go over that with you. If you guys need those posters, let me see, was that it? Oh, hang on. Therapeutic, delegation. Yep, that was it. So those are the posters that I was talking about. All righty. Any questions? How's everybody doing? I guess you're okay. All right. So now
We're here. We're all
good.
here.
They're probably thinking about my exam.
Oh my God, sure am.
Aw. All right, guys, let's take a look at this. All right. So, LPN comes upon a multi-car accident. Which client should the LPN care for first? What type question is this?
A priority question.
It's not really a priority.
Who would you see first?
Because it's more than one patient. Very good. Who do you see first?
And I like those questions.
I do too. They're my favorite. So you're going to use your who do you see first rules. All right. Ooh. All right. So let's look at each one. 64-year-old reporting chest pain. Yikes. 35-year-old with a compound fracture of a tibia. 16-year-old broken jaw. 2-year-old bruise on the forehead. Okay, with that, do you see any stable that you can get rid of?
The fourth one.
Yeah, I don't see anything too bad there. Let's get rid of that one. And that's how I want you to do it. Very good. You're not going right to the answer, are you? No, mama, you're not. You are trying to roll out. Okay, so we want the most unexpected, the most unstable, the most unsafe, and bring in your ABCs. So, the 64-year-old reporting short chest pain, is that A, B, C, or none?
A.
Is it breathing? Are they having trouble breathing, or are they having chest pain?
I'm gonna go with none.
Okay, or you could say circulation.
Or circulation, yeah.
Yeah. C, circulation. They're not getting enough circulation to their heart. Okay, so put a C there. All right. Now, what about the 34-year-old with the compound fracture of the tibia? A, B, C, or none?
None.
Well, what would a fracture do?
Could bleed.
Would it interrupt with your circulation? Or could it? Okay, so let's put a C there.
But
All
that's
right.
really reading into the problem.
You be quiet. It isn't. Okay.
Isn't it?
So, compound fracture C. Okay. 16-year-old broken jaw. A, B, C, or none?
Think about your position. Where is it located?
The jaw. Would it be your airway?
Airway breathing. Very good. Put an AB there. Very good. We got rid of 4. Okay, so now, with what you just said, what one do you think you would go with as your answer? Or what ones are you going to get rid of? Whichever way you want to do it.
I would get rid of 2 and 4.
We got rid of 4. Okay, so now number 1 is a C, number 2 is a C, and number 3 is AB. What's your answer?
3.
Number
3.
Yep. Number 3. Whoops. Okay, you can see that that means unstable, 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 stable. We got rid of number 4. Next, circulation, circulation, airway. Get rid of those two. There's your answer. And this is a highly missed NCLEX question. Why? What do you think people who don't know Kaplan, which one do you think they put as their answer?
Number one.
Yep. This is why the decision tree and strategies help you. Okay, everybody see that? Yes?
Yes, ma'am.
Okay, let's do this one. The LPN cares for clients in a long-term care facility. The client's family asks the LPN, why is it necessary, that's okay. Why is it necessary to have a copy of a living will in the client's chart? What response by the LPN is best? What kind of question is this? Priority or evaluation?
Priority.
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 We're going to use our tree. Very good. What's step 1?
Gathering information.
No.
No,
Topic.
Topic. Very good. Okay, what's our topic? Look at your answer choices too when you're trying to decide the topic. Do not just look at the question. And remember, don't go to your answer choices for the answer. Work the problem out. The more you do this, the better and faster you're going to get. Okay, so
is it the
what is
living
our
will?
topic?
Is it the living will?
Yeah, living will. Very good. Best action or best response for living will. Very good. Okay, let's go on to step 2. What is step 2?
Gathering data versus implementation.
Very good. So you simply ask yourself, are you gathering data? Okay, so number 1, are you gathering data? Or are you just explaining something?
Just explaining.
Just explain.
Yeah, so you're not, so put an I there. Okay, number 2, are you gathering data? Or are you just explaining?
Just explaining.
Just explaining, so you put an I there. Number 3, are you gathering data or are you just explaining? Not gathering anything. You didn't ask them the names of their relatives. You're just telling them. The living will lists the names, so you're explaining. So that's an I. Number 4, are you gathering data?
No.
No, those are all I's. Step 2 did not help us, so we're going to move on to step 3. What's step 3?
Physical
versus psychosocial.
Right, physical versus psychosocial. Well, if you look at that, does that really fit? Isn't this all kind of psychosocial in a way? Because it's all about teaching what the living will is. So none of this is really physical. So we can move on. Step 3 didn't help us. Is airway breathing, step 4, going to help us?
No.
No. Okay, so we are at step 5. We can only choose one. We have to keep them safe, and we got to stick with the topic. Which one of those is the best response about a living will for the client? What about number 1?
Is it? No.
No, get rid of it. What about number 2?
Yes.
Yeah, let's
Yeah.
keep that. Let's keep that one. That's pretty good. It helps the team know what the client's health wishes are. Yeah, that's exactly right. Let's keep it. All right, what about number 3?
Doesn't a power of attorney do the financial affairs?
Yeah, this is not a living will. That's a power of attorney for their financial affairs. We can get rid of that one. What about number 4? Is everybody 65 and older required by law? What about a 20-year-old who's dying of cancer? So
Isn't
is the last one correct, or can we get rid of it?
Get rid of it.
did not
Get
law?
rid of it. Yeah, there's no law that makes anybody 65 and older. And besides that, what about if you're younger and you're dying of cancer? So yes, number 2 is the answer. Very good. Very good. All right, let's move on. Okay, the healthcare provider orders wrist restraints for the confused, agitated client scheduled for a closed needle liver biopsy. The LPN identifies which action should be taken at this time. When it asks kind of like that, kind of say to yourself, which action should you take next? So with that, is this a priority question or evaluation? When you say the word next.
Priority?
Priority. Yeah, next is a priority. So we're going to go ahead and do our tree. All right, well, step 1 is
Topic.
Topic.
All right, so let's look at it. What's the topic here? And look at your answer choices too.
The wrist restraint?
Yeah, very good. And the best action with the restraints. Very good. All right, let's go to step 2, G versus I. What's number 1? Are you gathering data?
Yes.
Well, you're asking them to sign something. You're not really gathering any data, right? It says ask the client to sign an informed consent after you explained why restraints are necessary. So you're not gathering data, are you? Can you guys see that? So it's an I, right? Everybody see that?
Yes, ma'am.
Okay, so that's I. What about number 2? Are you gathering data?
No.
No? So that's an I. What about number 3? Are you gathering data?
Yes.
Yeah, so put a G there. Number 4, are you gathering data?
No.
No. Okay, so we got 1 G. I always check my G's first to see if it makes sense. Now, you did not hear me say that I always pick my G's first. No, I said I check them. If it makes sense, you got your answer. Bingo, you're done. If it doesn't make sense, you move on to step 3. You get rid of it and move on to step 3. Okay, so does it make sense for restraints that you observe and document movement, color, temperature of the client's hands and fingers after the restraints are applied?
Yes.
Yeah, that does make sense. Okay, so now what I do is I go to number 1 and I say, would I do number 1 before I would do number 3?
Yes.
Okay, why would you not do number 1? Look in your question. What tells you
Confused.
he's confused? Yes, you cannot ask a confused client to sign a document. Very good. Get rid of number 1. All right. Now, would number 2, let's do it the other way. I kind of turned it. This is the way I usually do it. Would I do number 3 before I would do number 2?
No.
Okay. Why? There is something wrong with number 2. What's wrong with number 2?
You don't
You
attach.
don't do them to both sides.
You don't attach it to the rails. So that's wrong. So still number 3 is right. Let's get rid of number 2 because it says tie the knots of the wrist restraints firmly to the side rails. Where do you put the ties?
The bed frame.
The bed.
Right, the bed frame. Very good. So get rid of number 2. All right, would we do number 3 instead of or before we would do number 4?
No.
Okay, there is something wrong with number 4. That is a chemical restraint. NCLEX does not like you giving chemicals to restrain a patient. They're very dangerous. You can kill a patient. You're possibly causing harm. They could have a reaction. You could give too much. They could stop breathing. There's a lot of side effects to benzodiazepam and those type of medications. So between 3 and 4, what's the better answer?
Number 3.
3.
Number 3. Yes. There you go. Okay. Anytime you're giving a medicine IV, you got to be very careful because that goes right into the vessels and it reacts very quickly. And so you be very careful about any kind of chemicals restraints. So yes, number 3, yes, in this case, you got your answer in step 2. You did pick the G. The I's we got rid of. Does everybody see that? Does that make sense?
Yes, ma'am, it does.
Okay. All right. This one we're just going to skip on by because this is like nursing basic 101. You guys, what's the answer here?
Number 4.
Yeah, very good. Yeah, that one is, although don't be surprised, you could see that one in NCLEX because, again, it's critical thinking. Okay, believe it or not. All right, let's move on to this one. So the LPN assists the RN with the admission of an elderly client diagnosed with fracture of the left humerus. The LPN notes multiple bruises over the client's back and upper legs and small burned areas on both arms while assisting with the client's gown. Which is the best action for the LPN to take? What type question is this? Priority or evaluation?
Priority.
It's a priority. Very good. Okay, so we're going to do our tree. What is step 1?
Topic.
Topic. Okay, what do you think's going on here?
Possible
Or
abuse.
what do you suspect?
Abuse.
Abuse. Suspect elderly abuse. And your best action. Very good. That's the topic. Okay, step 2, G versus I. Okay, what's number 1? G or I?
G.
Are you gathering data? Yes.
G.
G. Very good. Put a G there. What about number 2? An I. Very good. What about number 3?
G.
Very good. And what about number 4?
G.
Very good. Excellent. Well, wow. We have 3 G's and 1 I. Miss McBride says always check the G's first. Well, okay. Now, if you guys are good at this and smart, for something like this, you can go to your one that's alone, the I, and see if it makes sense. But let's just be consistent right now and do it the way I do it. Okay, so let's look at each G. Ask the daughter to explain how the bruises and burn areas occurred. Would we do that?
No.
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 Why? Why do you think we might not want to do that?
Because that's a daughter and not an elderly.
Absolutely. And what if she's the one that's doing it?
Right.
Right? Okay, let's get rid of number 1. Okay, we're keeping number 2 for a minute. What about number 3? Keep it or get rid of it? Ask the client to talk about it.
I'd say keep it.
Well, keep it.
All right. What about number 4? Are you going to go in there and start snapping
No.
pictures?
No.
No.
No. And let me tell you something that's out of your scope. You would not be doing that. The RN would do that. So let's get rid of 4. Okay. Now, think about it. Between 2 and 3, which one is the better answer? Think about what could happen if you ask the client.
2 would be the best answer.
Yes. Why did you say that, darling?
I chose 2 because the client, if you ask the client about the bruises, they may not comply. Most of the time they won't. The elderly won't comply.
Absolutely. They're going to be afraid to answer you. It's like, oh my God, I can't answer that. If my daughter finds out I told you, she's going to beat me up. Okay? Absolutely. So you're going to notify the RN. Very good. Now, some of you might have went ahead after you saw that there were 3 G's and 1 I. You might have went right to the I and say, that sounds good. Let me make sure. No, I'm not going to do number 1. No, I'm not going to do number 3. No, I'm not going to do number 4. And there you go. Your answer is number 2. And that's fine. Either way. Is everybody following me?
Yes.
Yes? How are you guys liking it?
So far, so good.
Okay, good. All right, let's do this one. Yay, I love these. LPN, this is Miss Manner's favorite too. The LPN is assigned to assist in the care of 4 clients on an acute care PEDS unit. Which client should you see first? So what type question is this?
Who do you see first?
Who do you see first? All right, so we want the most unstable, the most unexpected, the most acute. All right, so let's look at this. So what you do first is you go through them and you either keep them or get rid of them. Don't be afraid to if you don't know, just to keep them. All right, an 8-week-old had an open pylorotomy yesterday. Keep or get rid of?
Keep.
All right, let's keep for a minute. All right, a 3-month-old that has a pelvic harness applied 2 hours ago.
Keep it.
Let's
What
keep
is
it.
that?
Okay, a 3-year-old had an open reduction of a fracture femur 6 hours ago.
Keep it.
All right, a 5-year-old in a mist tent for the treatment of laryngotracheobronchitis.
Keep.
Keep. Okay. See, it can be kind of difficult. All right, let's try our ABCs. Number 1, is that A, B, C, or nothing? Pylorotomy is fixing the sphincter.
Nothing.
Nothing. Okay. Probably could get rid of that one. The only reason why you get a little afraid is because it's 8 weeks old. So it's up to you right now, but pretty much it's a nothing. But what do you guys want to do? You tell me.
Throw it out.
Get rid of it. Okay. What about the 3-month-old with the pelvic harness? Is that airway
It's
breathing
that,
circulation or nothing?
Well, what is a Pavlik harness?
Did you guys ever hear of a baby with hip congenital disease where their little hip socket is out of place?
They're popped out of place? Okay.
Yeah. And they
Yeah,
put a
right.
Pavlik harness on them to pop it back in.
Okay, so I would throw that one out.
Is. Yeah. Should we keep it or get rid of it?
Get rid of it.
Get rid of it. Okay. Now, the 3-year-old with the open reduction fracture, is that airway breathing, circulation, or none?
It would be circulation.
Possibly circulation.
Circulation. Okay, put a C there. And the 5-year-old missed tent for the treatment of laryngotracheobronchitis. Airway breathing, circulation, or none?
A and B.
A and B. All right, so which one?
4.
Very good. Highly missed NCLEX question. Highly missed. Which one do you think they go for?
Number 3.
They go for number 3 or number 1?
Or number 1.
Because it's an
Okay.
8-week-old. Right away. Yep. These are people who don't know what you guys are being taught. Yeah. So, yeah, did you guys ever, if you ever took care of a patient with croup, I'm telling you that their airway can close off in a matter of seconds if that swelling gets so bad, and it can swell up quickly. Laryngotracheobronchitis is very serious. And if they are in a tent already in mist, you know they're sick. Yeah. The open reduction, that's circulation, that definitely is a serious thing, but number 4 is first. That baby can die, 5-year-old can die within seconds. You can't get anything down that throat. All right? Everybody see that? Yes?
Yeah.
All
Yes,
right.
ma'am.
Good. Oh, this one's kind of just a definition. Does anybody know this?
Is it battery?
Malpractice.
Battery?
It's not malpractice. It is
Battery.
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 Yeah, when you're holding them, when you're touching them and making them forcibly, that's battery. Yeah.
And assault.
Practice would be that you're not doing something that a reasonable nurse at your level would be doing. That's malpractice. False imprisonment is keeping them in a room or somewhere where if they want to leave, they have a right to leave. That makes sense?
They just had that, Miss McBride.
Did they? Did you
Yeah.
guys? Or is that Lynn, Miss White saying that?
Yes,
Oh, okay. Oh, your voice, you sounded so young.
I am.
I didn't know who you were. Okay, guys, this one's a good one. All right. The LPN is assigned to work with 2 registered nurses on the acute care med-surg unit. The charge nurse makes assignments for the next 12 hours. Which assignment should the LPN bring to the RN's attention? Okay, what type question is this? A priority or evaluation?
Evaluation?
It's an evaluation. And it's kind of a delegation one, isn't it? Doesn't this sound like a delegation? Okay, and you're looking, it says, which assignment should the LPN bring to the RN's attention? So we're looking for something, what? Wrong or right?
Incorrect.
Incorrect. Very good. And that's your strategy right there. Looking for something wrong, and it's about delegation. Okay, so let's see if number 1 is wrong. An RN is assigned to a client admitted 2 hours ago with the diagnosis of bacterial pneumonia using a non-rebreather mask. Anything wrong with that?
No.
No,
No.
that's a good one for the RN. They just got admitted. The RN has to be assigned to that one. It's a new patient. Okay, nothing wrong with that one. Let's go to the next one. You want what's wrong. An RN is assigned to the client who had an open reduction and internal fixation surgical procedure for a fracture of the right femur 48 hours ago.
That's not wrong.
Nope, not wrong. Because of that open reduction internal fixation procedure, this patient needs a lot of neurovascular checks and assessments. You got to give it to the RN. Again, this is NCLEX world. The RN's got to take care of that one. All right, next one. Is this one wrong? The LPN is assigned to a client just returned to the unit after a subtotal thyroidectomy procedure.
Yes, it's wrong.
Oh, yeah. Why is that wrong?
Since
The
he's
RN
just
just back.
Yeah, he
And
just
then-
came back from surgery. An LPN can't take that patient. That's like having a new patient again. Yeah, so let's keep number 3. All right, last one is 4 wrong. An RN is assigned to the client receiving interferon, alphacon 1, or Infergan for the treatment of hepatitis C. Anything wrong with number 4?
Miss McBride,
Yes.
I just have a clarification question for you about the actual topic of the question. It's asking which assignment should the LPN bring to the RN's attention, which means which one can the LPN do instead of the RN, or which one does the RN have to do? I didn't know quite what bring to the RN's attention.
Okay, why would you bring something to the RN's attention?
Because you can't do it, or it's a beyond
Because
your scope.
something's wrong.
And something's
Because
wrong.
something's wrong. So you're
Okay.
looking for what is wrong. Does that make sense?
Yes. What is it? You go
Okay.
through answer
And
choice.
so far, nothing wrong with 1. Nothing wrong with 2. Why would you bring that to the RN's attention? Nothing wrong with it. Number 3, something big's wrong there. The LPN cannot take care of that patient. Hello, I got to go to the RN and bring it to her attention. Number 4, anything wrong with number 4?
No.
No, interferon, that's a very dangerous drug to give. It's almost like giving chemotherapy. Yeah, that patient needs a lot of assessment. Very dangerous, a lot of side effects. Only the RN should be doing that one. That's IV too. Okay, so what's your answer?
3.
3.
Very good. Very good. Do you guys see how that works with delegation and looking for something wrong? You did 2 of them together. Do you guys see that?
Yes, ma'am.
All right. Good job. Okay, let's do this one. While the LPN cares for the clients on a med-surg or a surgical, cares for clients on a surgical client care area in a hospital, the LPN notes an RN entering data about clients into a personal digital assistant device. What is the most appropriate action for the LPN to take? What type question is this?
Is it priority?
Is it a priority or evaluation? Yeah, it's a priority, the word most there. So let's do our tree. What's the topic? Let's see if anybody
HIPAA?
can figure out the topic. Step 1.
Been using a
HIPAA?
Yes!
device.
Breaking HIPAA. Good job. Whoever that was gets an A for the day. Yes, breaking HIPAA. Why is this person breaking HIPAA? Why? How did you know that?
Because they're putting it into like their personal.
Yes. Their personal phone or whatever. Good job. Excellent. So breaking HIPAA. And what's your best action? Okay, step 2, G versus I. What's number 1? Are you gathering data?
No.
No, put an I there. Number 2, are you gathering data?
Yes.
Okay, put a G there. Number 3, are you gathering data?
No.
No, put an I there. Number 4, are you gathering data?
No, ma'am.
No, so put an I there. All right, I always look at my G's first to see if it makes sense. Number 2, ask the RN why it is necessary to record data in the PDA. Keep it or get rid of it?
Get rid of it.
Get rid of it. Why?
Because you
What
don't
is
ask why even to the
rules?
RN.
You never ask
Why?
why. Yes. Don't ask why, not even to your staff. That's confrontational. Get rid of number 2. Very good. Cross it out. All right, so now we're left with 1, 3, and 4. They're all I's. We're going to move on to step 3. What's step 3?
Maslow?
Maslow. Physical versus psychosocial. Unfortunately, so far Maslow hasn't really helped us. Can you guys see if Maslow doesn't really help us on this one, does it?
No, ma'am.
Nah. Maslow, come on. All right, step 3 didn't help us. How about step 4, ABCs? Is that going to help us?
No, ma'am.
No. Come on, ABCs. All right, so we're at our last step, step 5. You can only do one thing, and you got to keep the patient safe. Which one's it going to be?
Number 1.
Number 1. Yes, something's wrong here. I need to report it to the RN, my supervisor. Very good. She'll take care of it. Very good. Excellent job, you guys. Does everybody see that? How you did that?
Yes, ma'am.
Very good. And you guys, while you're practicing this, it's going to take you a while. Don't put any time limit. Give yourself the time to think it through like you're doing right now with me, because you're learning the steps. You're trying to get better at it. Once you get going and you get this down, you're going to go just as fast as you would without doing it. And you're going to be more accurate. But you have to practice it. So you can't practice it when you're taking the test. Now you can use some of your strategies that you're learning right now to help you make decisions, but you may not have it down yet while you're testing. You have to practice it at home. Get an NCLEX book. Get into your Kaplan and make a quiz on that one box, that orange box. Make some quizzes up on your topic and do this. That's when you want to practice, because you have to practice this to make it work. Okay, all right, let's try this one. The LPN completes an incident report about nursing care the client received while in a long-term facility. Which statement is true about an incident report? What type question is this? Priority or evaluation?
Evaluation.
Evaluation. And what you're looking for, what is? Right or wrong?
Incorrect.
Incorrect? Which statement is
You're looking for what's correct.
what's correct? What is true about an incident report? Very good. So let's look at each one and say to yourself, is this true? All right, the first one, is this true about an incident report? The incident report becomes part of the client's permanent medical record. Keep it or get rid of it. False. So we what?
Get rid of it.
Get rid of it. We only want true. Get rid of it. Okay, next. Is this true? The incident report is completed prior to contacting the healthcare provider about the incident. Keep it, get rid of it. What do you think?
Keep it.
Let's keep it for a minute. C. Next, is this true? The failure to report a change in the client's condition requires an incident report.
That's
True
false.
or false?
False.
Is that false?
It's true.
If you
I
don't
know that
report,
a change in their condition is
yeah, if you don't report that your client is going downhill and then all of a sudden they code and you didn't report it or didn't keep anybody up,
That's
is
true.
that a problem?
Yes, ma'am.
And you'd have to write an incident report. Because in today's world, if your patient's condition changes, if you went in at 8 in the morning and then at 10 o'clock you went back and they're not breathing good, you better be calling a rapid response, or you better be notifying your RN. You better be reporting the change in your client. If you don't, you have to make an incident report. So, with that knowledge, are we keeping 3?
Yes, ma'am.
Okay, let's keep it. All right, number 4. Falls do not cause it. Wait a minute. Falls that do not cause injury do not require an incident report.
That's false.
That's
False.
false. Get rid of it. Okay, now between 2 and 3, which one would you keep and what one would you get rid of? You want a true statement about incident report. Is it 3
So
or
3.
is it? Very good. It is 3. What's wrong with number 2? Do you
Because it
fill
said-
out an incident report before you call the doctor?
No, ma'am.
No.
It's
You call-
wasting time if they're hurt, right?
What's that?
Would you, if you take the time to complete the incident report, which I've heard is kind of extensive, that client could be sitting there without care.
Exactly. Yeah, you got to call the doctor. Yeah, you call the doctor first. And then when you're filling out the incident report, it'll ask you right on the incident report, did you notify the healthcare provider? Yeah, so that's why number 2 is not right. You don't do the incident report and then call the doctor. No, no, no. You call the doctor first. Very good. Good job, you guys. All right, let's try this one. I know we're going over a little bit, but as long as you guys are okay, I really like, because we are really being thorough this time. I'm explaining a lot more to you about some strategies. I hope this hasn't confused you. I hope it's helping you. What are you thinking?
Definitely helping.
All right. Yay. Yay. Okay, let's look at this one. The LPN enters the client's room to administer a 4 milligram morphine sulfate IM injection to the client. The client states or says, I really don't want that injection. I would prefer to have a pill for pain control. Which response by the LPN is most appropriate? What type question is this?
Priority?
Priority. Very good. We're going to do our decision tree. Yay. All right. Step 1. What's the topic?
Would
The
it be
patient won't refusal of the medication?
Okay, kind of refusing. What might be even more important? They're not just refusing, but they what? Want what?
They want a different route of
They
administration.
want a different route. They're asking for a different route. They don't mind getting the medicine. They just want a different route. Very good. Very good. Okay, let's go with step 2 then. G. Or G versus I. All right. So, number 1, are you gathering data?
Kinda, yeah.
Yeah. Okay, so put a G there. Number 2, are you gathering data?
No.
No. Put an I there. Number 3, are you gathering data?
No, ma'am.
No. Put an I there. Number 4, are you gathering data?
No, ma'am.
No. Put an I there. Okay, well, we got 1 G. Why do you want that pill? Keep it or get rid of it?
Get rid of it.
Get rid
Get
of
rid
it.
of it. Why are we?
Don't ask why.
You don't ask why. Say, Miss McBride, don't ask why. Okay, so let's get rid of number 1. All right, so we're left with 2, 3, and 4. Those are all I's. We're moving on to Maslow. Let's see, psychosocial versus physical. Well, teaching, when you teach somebody something, that's psychosocial. So, number 2, is that psychosocial?
Yes.
Okay, we can get rid of that then.
Mhm.
Okay, because you're teaching them that. Okay, let's get rid of that one. Number 3, no, that's not. Number 4 is not. Okay, 3 and 4 are physical. Well, we got rid of number 2. Thank you, Maslow. Thank you. All right, let's move to airway breathing, step 4. Is that going to help us?
No, ma'am.
No. All right. Airway breathing didn't help us. All right, so now we're at step 5. You got 2 left. Got to keep them safe. Which one is it?
4.
Yeah. Good job. Why? I'm not supposed to ask you guys why. Why did you go with number 4?
Because number 3, you're still trying to force the injection on them, and
Exactly. Excellent. Excellent. You guys, this is a highly missed NCLEX question. Now remember, they don't know what I taught you. What one do you think they go with?
probably 1.
Yeah. Yeah. They pick number 1. Yep. But remember, they don't know what I'm teaching you guys now. So very good. Excellent. All right, you guys want to do another one? Are you okay?
That's fine.
Okay. Is this the last one then?
Yes, because we got to study for a test.
Oh, bless your heart. Okay. So this will be the last one. Okay. All right, guys. Let's kick our butts in here and do it good. All right. The LPN receives an order to administer 50 milligrams of captopril orally to the client diagnosed with heart failure. The LPN notes that in the unit's reference book, the recommended first dose of captopril is 12.5 milligrams PO. Which action by the LPN is most appropriate? What type question is this?
Priority.
Priority. So we're going to do our steps. Okay, step 1. What is the topic?
Medication.
Captopril.
Yeah, captopril medication what?
Mom, what do you want? Error, dosing error.
Maybe, yeah, like you're suspecting or questioning. Let's put it this way: a concern or a question of the first dose amount. Okay, so let's move on. Step 2 is
G versus I.
G versus I. Okay, what's number 1?
That's gathering information.
Okay, G. What's number 2? I. What's number 3?
G.
Call the pharmacist to clarify. Yeah, because you're asking. Okay, G. And number 4? I. Okay, we have 2 G's. Let's see if they make sense. What about number 1?
No, because you're already giving the medication.
Right. No, we don't know about that dose. We don't want to give it to them and then suffer the consequences. No, get rid of number 1. What about number 3? And by the way, NCLEX doesn't want you to call a different department. They want you to stick with your own or call the doctor. So what about number 3?
Get rid of it.
Get rid of it. Yeah, you're not going to call the pharmacist, although in real life, do we do that? Oh, yes, we do. But let's get rid of number 3. Okay, now between 2 and 4, those are both I's. Well, Maslow doesn't really help us unless, inform the client that the dose is too high and refuse to admit. Maslow and ABCs don't really help us. So we're left with those 2. Which one is it that you're going to keep the patient safe?
Number 2.
Number 2. Very good, you guys. Excellent. Oh, who do you see first? Oh, well, we'll do that another time. God bless you guys. Well, what do you think? Was that a good review?